Hello, everybody. Welcome to today's webinar, part 2 in our Transgender Competence and Quality Care series. We're so pleased that you have joined us today. My name is Joanna DeBow, Program Coordinator here in ASTA, and I'll be hosting this session. My coworker, Brenda Cruz, will be managing the chat box. Please use this chat box to communicate with other participants and our panelists, ask your questions, and make comments. We want you to engage with us and each other and fully participate in today's session. So once again, welcome. Today's sessions, we are going to be having 4 panelists that I will be introducing later on, but I wanted to say hello to Mr. Gary Paul Wright, Ms. Adriana Lin, Mr. Shawn Coleman, and Mr. JT Perez. We are so happy to have them here. So a few guidelines for everybody. All phone lines will be placed on mute, except for the speakers when it's their turn to present and answer questions. Today's session is being recorded and will be available for everybody after this and for you to share as well. Questions will be answered during the presentation and also during a final Q&A period. The way that this session is going to be working is we have it separated in 2 sessions. First, we're going to hear from personal experience and then best practices. And between each section, we're going to be having a short Q&A. And then at the end, we're going to open the mic for all of our panelists for you to ask questions. So please do not wait until the end. If you have any questions, use the chat box and Ms. Brenda is going to be managing that. So today's session is offered by our SIBA for Health Equity Program grant. Please follow us on our social media and use our hashtag #ProceedSIBA4Equity. So before we get started with our panelists, let's get to know each other. I'm going to run 3 poll questions just to know who's here, where are you from, and just to have an idea. So the first one that we have here is, we want to know in which region of the US you are. So I will leave it for a few seconds. All right, 5 more seconds since we have more people joining us. Okay, I'm going to be closing the polls in 3, 2, 1. Okay, so let's see what we have. 38% of you are from the Northeast, 41% from the South. We have 12% from the Caribbean and 3% from the Midwest and 3% from the West. So thank you, everybody, and welcome. Next, we want to know, what type of organization do you represent? So please try to find the best one that represents your organization, either hospital, medical group practice, a community-based organization, government at all levels, healthcare clinic, or other. And if it's other, please use the chat box. Okay, 7 more seconds. Closing, 3, 2, 1. Okay, and 62% of you are from a community-based organization. Then we have 13% from healthcare clinic or federal qualified health center, 10% from government agency at different levels, 9% from others. The others we see here: University, Florida Health Department. Let me see the chat box. Okay, and then we have 6% from hospitals or medical groups. And then our last question, we want to know which of these groups best describes your position within your organization? Are you a leadership role, mid-management, frontline, either clinical or non-clinical, or other? And please let us know in the chat box. All right, 5 more seconds. 3, 2, 1. Okay, and 43% of you are from a non-clinical frontline, 21% mid-management, 50% leadership, 14% clinical frontline, and 7% other, including a triage coordinator, as you see here on the chat box. So this is a very good spread and very important to have, so the message really gets to all the levels of all different organizations. So we're very happy to see this. Thank you. Okay. So today's objectives, we're going to be describing the barriers to care and health disparities within the transgender community. We're going to identify some resources to include quality care for this community and changes in care that can be made to really reduce these barriers and offer a quality, culturally competent service for this community. So here's today's agenda. Like I mentioned, we're going to be dividing this into 2 parts. First is personal experience in healthcare, and then we're going to talk about best practices. So part 1 is personal experience, and we're going to start with Ms. Adriana Lin. So Adriana Lin is the founder and CEO of Adriana's Center, an organization dedicated to providing direct services, including HIV testing and linkages to care and prevention in South Florida and Puerto Rico. Adriana is a passionate trans educator and advocate originally from Peru, where she graduated from law school. Adriana is currently the head of the South Florida chapter of the Trans Latina Coalition, chair of Flux Puerto Rico, and the 2020 chair of the Human Rights Campaign Elevate program. Most recently, Adriana was a recipient of the 2019 Robert Wood Johnson Health Equity Award. Adriana was also one of our presenters of part 1 of this session. So thank you so much, Adriana. I am going to open your mic. Hi, Adriana. Can you hear us?
Yes. Hello. I'm sorry. Well, thank you so much to the National Center for Training and Support and Technical Assistance. My name is Adriana Lin, and I am right now in the beautiful island of Puerto Rico and Rio Piedras because we are doing some work in Puerto Rico. And also, my organization is one of the organizations located in South Florida. Like you see, I am maybe one of the persons from the South, what is the most affected um, portion of the transgender community, and a specific woman of colors. Next slide. So as you know, right now I have a leadership position of one of the most trust and stronger organizations led by one transgender woman openly living with HIV was not easy, right? Nobody wants to have that label uh, of of HIV because as the stigma is a lot. My history is really maybe different than the other ones because many people and specific the anti-immigrant or anti-Latinx people, they don't understand our culturally and our feelings or our history. I am from Peru. I was born and raised and complete my education, becoming a attorney or lawyer in my country. Was a very bad, very bad, very big decision and a strong decision to coming my comfortable life in Peru to coming to United States just to have my dream come true. And I know United States is the country of the dreams come true. So I want to be as the girl I am and the person who I am right now. So that's what I was a difficult decision to come into the United States in order to start my transition. Uh, and I'm start when I come into United States. I am by myself in United States. My family, my father, my mother, they live in Peru. Um, my father in last February was his one of the legs was has amputated, um, and I cannot go back to Peru because I have a special um, immigration status. What is like I am in one gold cage, right? I can live in United States. I can make amazing work and I can show my talents to the whole United States, but I cannot go out of the United States because if I coming out to United States, I cannot coming back because United States take me like I'm self-deporting. So was very difficult my life in United States, but I'm very happy also because I am one of them the transgender woman who they have a lot of support of my family, and I know. Many people they know that the numbers. Last week we give a lot of numbers, a lot of data, but not just you're going to have my my testimonial over here, right? You're going to have I know the testimonial of many transgender who I change life or I give services to them because something is different. You can have agency just to advocate and other agency to give services that change the life to the most vulnerable community. And that's what is my proud. I'm very proud to be one of the person who they really working with the community, change the community. When that's why when people they talking about grants and we have to empower the leadership of the people living with HIV. How they don't empower the transgender openly living with HIV, living in the South, who have a who have organization and change life of other many vulnerable communities. But it's very difficult to change to change minds. And my role in this life is not to change all the minds. It's just to change some few minds who they can be the key to change the whole community of the transgender community. Next slide, please. Thank you. In addition to the stigma of transgender have, I remember when I working in the health department in Orlando, Florida, and, as a peer, and one of when they give me the trainings, also, the health department and the institutions and HIV organization was my really university because even as I'm a lawyer in my country, I have a whole career in HIV just because also I am HIV positive, but I do my whole career. And I was when they give me the stigma, they say, "Oh, you have a lot of stigma. You have a trans, you are trans, you HIV positive, you are Latina, you have a lot of labels." Embrace me to people they don't believe in the talents, but I think they can one of the barriers, right? I think transgender community just need opportunity. Any of the transgender, they have to prove and they have to show the work and the big talent they have. Encourage several healthcare changes to navigate navigate my transition. One of the topics is when I becoming HIV positive and I'm living with HIV. One of the in my mind was a lot of problems because I never cheated my boyfriend. I never have a relations, and one of the possible risk factor to becoming HIV positive was because I have a hormone therapy. When the HIV and the HIV field, nobody talking about hormones injections or silicone injections and that kind of things we have sometimes by at the street when we're supposed to go to a clinic and they can offer us or they can live. And even, to many people who they are here and listen, maybe they were working in clinic and they say, oh, my clinic they don't have hormones therapy. But maybe your clinic have a case managers. So the case manager they can develop in one role for transgender and not maybe your clinic no offer hormone replace therapy, but they can offer may change, and so kind of different. The key points where they are transgender, they can be attractive because transgender, I don't want to go to a clinic for people they are bullying me, people they are laughing on me, peers or case manager, they mistreating me or they change the appointments. That is very difficult. So one of that is access to hormone trans competent providers, fear of discrimination. For many of the transgender specific, I work with one of the sector where it's sex workers. Sex workers, transgender, who they are HIV positive or they go to a clinic, any clinic for PrEP, they don't want to go all day in the clinic because they prefer go to stay at home. Next slide, please. Okay. Let me see. Oof, that picture. Oh my God. I put that picture just because when I put that picture, a lot of the people of the organization, CBOs and leaders calling me and say, I don't supposed to put that picture because it's too much, too sexy. But that is one of the pictures really, really what made me proud. I think that is a picture when I be young or youth. I have a healthy body, nice, and everything. I can take the whole world in that moment. And the whole world in that moment was impossible for me. The only option for me was be a escort or sex worker in New York and New Jersey area or in the three state area of the North to becoming self-sufficient and economic self and can have. That is the only part of my life. I'm here because I give my testimony. One, because last week I gave a training, and this time is because um, I really proud I am a survivor for many times, for many things what happened in my life. I am a proud survivor. Many I am maybe I'm not proud the ways how I survived, but I'm so proud I have a life. In United States, when the expectancy of the life of the transgender woman is 35 years, and I am in Puerto Rico right now. In the last 3 months, 5 transgender was murdered, and nobody just posting and they care just for the advocacy, but they never have a position to come in Puerto Rico or check one of the things that is very difficult. You know, for many of transgender, sex worker is the only choice. The second choice, and let me give you a tip for you. The second choice, if you don't want to be an escort, is a showgirl. Showgirl means a girl who they doing shows and that thing, who they are underemployment because they receive tips, they don't know employer, they don't have insurance. So, but if you know one of the showgirls, you can thinking is one of the girls she don't want to do the sex work, right? Or she's not in the sex work because for many of the girls who do a show, they receive very good treatment for the gay community, for the clinics and everything. Challenges to accessing a healthcare, like I told you, access to hormones, replace therapy, mental health, what is very important. Some girls they don't care or they don't want to take up hormones, but some girls they want to at least have a mental health who they helping or have a case manager who helping to get off of drugs or addictions or want to get helping to navigate in the system to get disability or whatever they think. Next slide, please. Living with HIV. That is how I learning that you have HIV can be very bad experience, of course. And that's why when I start my organization, right, I have I really provide programs specific for the transgender community, like example for testing. Beyond the fair lack of the care of the cancellation, it's very important to have a lot of care in incarceration. One of the programs for Diana Center is provide 2 weeks of transgender who they are HIV positive and they becoming detained in the ISO detention center. They can have 2 weeks. That is the window period to start navigate to the system. Um, and mental health issues is very important. Experience with immigrant trans woman, where there is not too much grants for immigrant trans women of color, specifically who they release the ICE detention center, is very, very difficult living on HIV. Next slide, please. Next slide. Yes, this is one of the numbers where they, and then last week a lot of people they very interesting about one of in four the estimate of number of transgender women living with HIV, 63% um, participating less of the 10,000 a year. Right now we start a project in Puerto Rico to start collecting data for the transgender community in Puerto Rico, and I'll make sure next year when we or next training when that project coming when the answers and the reports in Puerto Rico, I think more of the living with less of 6,000 or $8,000 in Puerto Rico, right? But in the United States, 10%, 45% participants with no health insurance, 21% estimate percent of the trans Latinas or Latinas women living with HIV in South Florida specific, one of the first and the second place in new HIV diagnostic, South Florida, Miami, and Fort Lauderdale, and we don't have too much specific trans Latinx translate agencies in Florida. We don't have too much support to help in that one. 44% estimate percent of the Black transgender women will live with HIV in South Florida. Next slide, please. And that picture what you see is the last lobby day Adriana Center did last January before the COVID-19 in Tallahassee, with Adriana Center bring more of the approximately 20 transgender women of color, including trans women who they are African American, coming and make a lobby. We make history in South Florida when we make the lobby and talking with commissioners and representatives who they are listen for the first time the experience of the transgender woman and voice of the real transgender woman of color or trans Latinas. That I'm very proud about that. Second, next slide, please.
Thank you so much,
So I'm
Adriana.
finished my. Thank you.
Yeah.
Thank you so much.
Thank you so much. Hearing you and your personal experience is very eye-opening for not just me, I'm sure for everybody in the audience. So we're gonna keep you around for right after our next presenter. You're gonna be answering some questions. Is there anything else you would like to add?
No, I'm okay. Thank you so much.
Okay, thank you, Ariana. I'm gonna mute you now. All right, so our next presenter is JT Perez. I'm going to open up his mic. All right, so JT Perez has been a prevention educator for Alianza of New Mexico since September of 2017 and has been involved in the HIV prevention and syringe exchange field through organizations that he has volunteered for since 2013. JT is trained to conduct testing for HIV, hepatitis C, and syphilis, helps run a syringe exchange program at Alianza and facilitates workshops in the Las Cruces, New Mexico community. JT is involved in this year's National Transgender Visibility March, scheduled for October 3rd of this year, which has going to be conducted virtually because of the COVID health crisis, but will connect thousands of people from around the world to demand equality, safety, and dignity for all transgender persons. In his spare time, he likes to work with other organizations that enable him to facilitate training, is involved with social justice groups, but also enjoys relaxing time with his dog at home. So JT, welcome, and the microphone is yours.
Thank you so much. Thank you for letting me be part of this webinar series. I appreciate the opportunity. I'll be addressing my personal experiences accessing healthcare. Coming out as transgender was a very liberating experience for me. The very first thing I wanted to do was get on hormones. So I went to see an endocrinologist who was able to get me in right away. It was a very happy moment in my life. Looking back, I probably didn't make the best choices, didn't advocate for myself. The endocrinologist that I first saw wasn't the best care I've received. Without even doing any labs on me, he immediately put me on testosterone, which I wanted. However, it was a high dose, which I didn't know about, and did create some harm to me. So that was my very first experience as a transgender person seeking transgender healthcare. It was not the best, even though this guy was a specialist. So I continued to see other doctors at community health centers. And back then in 2013, Las Cruces, it's a very small town. We have like 100,000 people. We don't have that many resources to choose from. So at the community health centers that I would attend, my very first experience, say with the front desk staff, was embarrassing. I would ask them to call me by JT. They would insist by calling me by my birth name. And they would say because of insurance reasons. So when the nurse would call me into the patient's room, they would call me by my birth name, and having to get up in front of other people, other patients there, it was very embarrassing. Going back into the patient room with the doctor, you could tell some doctors were visibly uncomfortable treating my other conditions that I have and coordinating it with hormones that they didn't understand. So basically for a doctor visit, that whole day would be anxiety ridden for me leading up to the appointment. And then after the appointment, I would be pretty much recovering from a humiliating experience. Now, 7 years later, I see a nurse practitioner that used to be at one of those community health centers. She provides the best care I've ever received. And instead of 20 minutes from a doctor, I get 1 hour from her. She treats the whole of me. She sees and validates all of me. I have a very serious kidney problem that developed. I don't know if it was from hormones. I wasn't warned to be on the lookout for that. I was warned about my liver. Honestly, I should have done my own research. But so yes, now my nurse practitioner, she treats me with a great care, and she practices the cultural humility part that we know works for our community. She doesn't pretend to be an expert and doesn't mind, I don't mind it when she says, I don't know, let me get back to you, because she gets back to me immediately. She'll get back to me within that day or the next day. And that's truly a very good experience for me that I wish other people could have. The specialists that she refers me to have been, I feel, very thoughtful on her part, because now I don't have to be embarrassed to say, now they're very understanding when I say, please call me by JT, please have your staff call me by JT. And I get that from all the specialists I see, which is like about 4 or 5 now. So to receive that type of care here in Las Cruces, it's been quite a change. And I feel very comfortable with with that process. Next slide, please. So therapy, I am in therapy, and mental health conditions are, not all trans people have mental health conditions, but it's just been part of my experience. And back in 2013, when I first started transitioning, we only had one therapist in town that we would refer to each other. That was because she continued her education with transgender care, along with sexuality, along with anxiety and depression. So we felt like this was a very good asset to have in town, and she has grown her practice tremendously. However, for personal reasons, it wasn't such a good fit for me, and I sought care from a community health center where I currently see my therapist. I've been seeing her for about 4 or 5 years. Again, she doesn't pretend to be an expert on transgender care, and in fact, it's been a learning experience for her. It's been a give and take relationship, and I've appreciated the efforts that she's made while not in sessions with me. I can tell when I enter the room, and I can tell when she's done some of her research or homework. Like some transgender individuals, I have received, I have been through some traumatic experiences, and she is the best person I've ever been to for EMDR. So I've been very happy with that experience with her. I'm very thankful for that. One thing that we want to be careful with here in our town are LGBTQ therapists or LGBTQ friendly therapists. We're finding that's not always the best fit for most of us being transgender people. Just because you know somebody who's transgender does not mean that you can understand our experience. Same thing with if you're a gay man, a gay white man, perhaps, I feel like there needs to be some humility expressed during these sessions rather than pretending to be an expert just because you're part of the queer community. So from what I hear from my friends, LGBTQ friendly therapists has not been the best experience here in Las Cruces. Next slide, please. Regarding social services, I haven't really accessed any. However, I do know that they have been problematic here, just from hearing from my clients as well as from the people I know in our community. You can tell that staff is uncomfortable knowing how to interact with some transgender people. Say like in homeless shelters, they still group people by their genitalia. With domestic violence, I think they still get a sense like, again, they're being grouped by their genitalia. It's a very dehumanizing experience. There's a lot of education that it needs to be done. And even if there's education to the staff, the front staff, the back staff, what have you, I don't know if there's a high turnover rate in these areas, but the education needs to be ongoing so they can be more aware of all the marginalizations that transgender people can exist in. And I think that's not taken into consideration in this town. Regarding our local university, there's this professor there that has made great strides to accommodate transgender students. She's a personal friend of mine. She is also transgender. And I think that's played a huge part in the positive changes that they've made there. The first thing that she fought for was what I think was bathrooms, making sure that there was a gender neutral bathroom in each building. Next was chosen name versus birth name. Now students are addressed by their chosen name. And then also regarding dorms, I think that just happened last year, maybe the year before. Students get to choose how they want to live and who they want to live with, whether it be a dorm that's shared or a dorm room that they have on their own. Next slide, please. So basically what we've done here in Las Cruces is the changes that our trans community has made has empowered ourselves. whether it be from the support groups, the Facebook page that we have going on, Facebook chat, sharing resources amongst each other. We're networking so we don't feel so alone. And it's been a very empowering experience. I want to recognize the statewide organization that we received assistance from, the Transgender Resource Center in New Mexico. They've definitely been able to help us provide that backbone as we've grown here in Las Cruces. Overall, it's been an empowering experience despite the barriers for myself. Thank you.
Thank you, JT. That was powerful statements, powerful story. So we very much appreciate you. Okay, so right now we are open for questions. Please take a few moments to type any questions that you might have for Adriana and or JT. In the meantime, we prepare some questions from some feedback that we received during registration. So our first question is for JT. Misgendering is something all trans people face. Could you explain why it is important to understand the significance of this and the impact on oneself?
Right. So in my experience, yes, I've been misgendered. And this destructs everything I have in my mind, whether it's in person or on the phone or here at work, you know, from my clients. The significance is important because, well, it tells me that I'm not being heard. No matter who I express myself to, if they continue to misgender me, if organizations misgender me, it tells me that I'm not being heard or validated. It's a dehumanizing experience.
Thank you. And Adriana, your mic is also open in case you want to comment as well. Sorry, I guess I was muted. Adriana, your microphone is also unmuted. And if you please would answer this question, what challenges and needs are specific to the Latinx transgender community? Adriana, you're still muted.
Hello? Hello?
There.
Hello? Oh, okay. I'm sorry. Yes, I think this is one of the big questions because trans Latinx people around this era, on this time, the anti-immigrant and anti-Latinx feelings growing up more specific in the founders, right? In the founders. So and the experience maybe of the people, they don't have a Latinx as an employer or trans Latina as an employee. So it's very important to hire trans Latinx people, trans Latina people, and give more opportunities. I want to highlight specific foundations who they are really know, and they are very expert about trans Latinx people like Borealis, like Trans Justice Projects in New York, who they are really know the feeling of the trans Latinx community, and they really have the feelings to working in community and disappear this kind of social stigma and the kind of things. I think it's very important. When you're going to be as my own experience, and I have a CBO organization, and when I apply in grants and I see who they grant, and they are Latinx or other organizations who maybe they are not Latinx, who maybe they are not vulnerable, who maybe they are not in the regional geographic area who they needed, mostly need the transgender community. That is very difficult, and when you don't put in the table the ICE detention center and the immigration needs or the trans immigration needs is very you don't help them with the Latin community. So that is one of the challenges, I think.
Thank you, Ariana. And before we move up with the other questions we have two questions from the audience. We have here Gary Summers asking for either of you, what would you say to someone who are with a primary care provider that is not treating them very well?
Immediately what comes to mind for me is to leave. Listen to your gut and seek some other care.
Thank you, JT. Paul Silverman is asking, beyond stigma, what are the barriers and challenges trans people are expecting in this moment of lockdown during COVID?
That's a good question. I don't know if we're expecting anything, honestly. I haven't even thought of that myself. Sorry about
Ariana?
myself.
Yes, excuse me?
Yes, Ariana. What are some of the extra challenges and barriers that trans people are facing during the COVID-19 lockdown?
Well, specifically right now, the trans Latina community and the transgender community in the South, they want to go back to the normally, but they have a lot of bills to pay in the back, right, for these 3 or 4 months. I think the challenge is a lack of resources, lack of information specific for the trans community. Many of the helping to the community is you know a specific funder they spend only 5 cents for the trans-led organization. So this is one of the big challenges that they don't empower and they don't make the trans community visible, specific in the COVID-19 area too, right?
Thank you. Okay, so few more questions here. Ariana, HIV testing is not the priority for many trans people. This is something that you mentioned in our previous part 1 of this series. However, hormone therapy is. Why is it important for an organization to provide both services?
But it's important to organization to provide both services because transgender, the social factor of the transgender there is very important to have for us. For many of us, we don't want to go to a clinic, like I told you before, HIV positive, to go to a provider who they are treat you bad, don't give out hormones. But if you can be compensated for something, because example for the hormone therapy, right? Many of the transgender they feeling very very bad buying hormones at the street. They feeling like they're doing illegal things, where it's illegal, but they feel it, but they need it because they want. But when one clinic they offer them the hormones, that girl feel that client going to feel more comfortable, more safety place to talking about themselves. That's why Trans Latina Coalition and Lambda Legal yesterday we claimed one of the suits to the new administration HFCC to for the healthcare, because it's very important to increase and not discriminate transgender individuals in the healthcare.
Thank you. And our last question before we move on to the next session comes from Sylvia Davila. Do you know of any current efforts to include transgender treatment in conventional medical curricula?
I'm sorry, I don't. This is JT. I'm not aware of that.
And this is an excellent question. I have seen, especially on Twitter, a lot of push from former medical students or current medical students talking about increasing curricula dedicated for special communities, like African Americans, LGBTQ. So I don't necessarily know the answer to this, of course, but I think somehow right now it's happening, the push to really, add this to the curriculum. So that was an excellent question. Thank you so much, Ariana and JT. I will be muting you now for the time being, and we're going to move on to the next part of our session, which is best practices. Our first guest is Mr. Gary Paul Wright. Gary Paul is the founder and executive director of the African American Office of Gay Concerns. He is extremely active within the LGBTQ community in Newark, New Jersey, where he served 2 3-year terms as a charter member of the City of Newark's Lesbian, Gay, Bisexual, Transgender, and Questioning Majoral Advisory Commission to 2014. He was appointed to the Essex County Executive's LGBTQ Advisory Board in 2011 and is currently serving a 4th 3-year term as well. His agency, the AAOGC, is dedicated to serving as a resource and safe space for the LGBTQ community in and around the greater Newark area. They are now state-approved HIV rapid testing site with HIV prevention and intervention programs, including Many Men, Many Voices for Gay, Bisexual, and Other Men Who Have Sex with Men, and SOS Saving Our Sisters, formerly Sister T, for young transgender women of color. The AAOGC was one of several organizations honored in the 2014 by the New Jersey State Senate and General Assembly with a joint legislative resolution, and was recognized in 2016 by the Newark Municipal City Council on National Transgender HIV Testing Day. Since 2008, the AAOGC is also known for spearheading the annual 1 hour of silence to end the silence, the noontime vigil that takes place each year in front of the Newark City Hall on World AIDS Day. So thank you so much, Mr. Gary Paul, and welcome. I'm going to unmute you now. Hello?
Hi, can you hear me?
We can hear you. The microphone is yours.
Yay, okay. Well, thank you so much for that introduction, and thank you for allowing me to participate. I don't want to run out of time this time, so I'm going to move a little fast here, okay? So as you can see on the screen, all these terms were not around when we first started the AAOGC, way back in 2000. We specifically wanted to do outreach and HIV prevention to educate Black gay men. And yet, we still wanted to be a resource for the entire LGBTQ community. But remember, this was a time when there weren't any statistics for trans people, and everything that was reported was lumped into the men who have sex with men category if you were assigned male gender at birth. So it would take like another 10 years before any of this changed, and rightly so. The LGBTQ alphabet just continues to grow as individuals begin to self-identify as from that category known as other. Remember how everything was like either LGB or other. So now we got butch femme, gender diverse, gender nonconforming, trans men who sleep with men, and nobody was using the proper pronouns at the time. They, them, theirs was like not even heard of. So next slide, please. So basically, as a community-based organization, one that is not clinical, remember we are non-clinical. We're just a service organization. But once our clientele, which was mostly young people, young Black kids coming in from downtown area, once they started identifying as transgender or gender non-conforming, so we knew we had to change our own tapes and change our way of thinking, and we had to find a way to provide services that were culturally appropriate for more than just MSMs. And like JT just said, cultural humility goes a long way. You really need to, if there's a population that you want to attract, you got to learn from that population. Don't just create stuff out of the blue because it's not going to work. And you have to make sure that your staff is trained in the right culture or competency. Your waiting room, your reception areas have to be friendly to the trans community or any community you're trying to attract. Your bathrooms, as was mentioned, you don't have male or female. You have all gender bathrooms. At least one you should have in your agency that is for all genders. Fluency of terminology. What that means is, don't just give lip service to this community. Don't just, learn a few key words. Know what you're talking about. Know who you're talking about. And if you're wrong, don't be afraid to ask questions. Don't be afraid to say, okay, teach me how I'm supposed to be doing this. And more important, gender identity data. Let people identify how they want to identify. It's one of the simplest things to use is a two-step method for gender identity. What is your gender? What is your current gender identity, or how do you identify? And what sex were you assigned at birth? Those two questions alone is going to save you a whole lot of trouble in the long run. Next slide, please. So basically, the bionic woman on the left, that was the first trans-related poster that we actually had in our office. And that's the one that started triggering a lot of the young people coming into our office to really say, hey, this place might be cool after all. And they started, showing up, and changing in our bathrooms, as I mentioned in the last session, and then going out into the streets of Newark and then coming back, changing back into their, cisgender clothing and then going home. So what we had to do was create visible markers of support throughout the agency, like trans-affirming posters, literature, brochures, or even just little stickers, the little the rainbow flag sticker and the transgender flag stickers. And we had to create an environment where derogatory language or jokes about trans people were not tolerated. So it's like if you hear something, say something, do something about it. And that's true, especially with a lot of people within the gay community. They just still don't get trans people, so there might be some inside jokes. So if you hear stuff like that, stop it right in its tracks. Next slide, please. So what you really need to do is modify all your documents, and this is for your clients and your staff, where gender or sex is required, to include identities across the gender spectrum. And again, I can't emphasize, let people identify how they want to identify. Use the pronouns that they want to use for themselves. Learn about other agencies and providers that offer LGBTQ affirming services, especially trans affirming services, before making your referrals. Do your homework, okay? And if you hear stuff about an agency or a doctor's office or a healthcare provider who is not trans friendly, do not keep sending people there, all right? Call them out for them, okay? It's a new world, and there are people out there who will do the work that's needed to be done. Identify the places that you should or should not refer LGBTQ patients to, and modify all referral lists to reflect this information and pass it along to all your staff. Everybody needs to be on the same page. And do not out somebody as gay or transgender unless it's necessary or in the line of duty. Even if somebody is out to you, they may not be out to everybody else. So please be cognizant of legal issues as well, okay? You don't want to get in trouble about anybody, but there are things that you may have to do where you may have to identify somebody as trans, but unless that person wants to, please try not to. Next one, please. Moving quickly here. Don't assume someone's gender or which pronouns they prefer. If you are not sure, just ask the person's name or respectfully ask. Don't ask somebody what their real or their legal or their dead name is, except where law enforcement is involved. And a person's preferred gender pronoun can change. And if you're not sure which pronoun somebody's using that certain day, ask them, okay? I mean, we had someone who identified as gender nonconforming as their identity. This person, looked male, and it was very hard for us, even in an agency like ours, to get the pronouns right. But like I say, and we also had one staff person who kind of changed genders on a day-to-day basis. One day she was Kira, and the other day she was somebody else. So I would ask her, and she sat at the front desk, and I said, "Who are you today? What are you today? Tell me." And it's so easy to do, okay? But it's also respectful. Next slide, please. Yeah, so a lot of people talk about transitions and all this kind of stuff. Try to use the word gender affirmation. And that was something that somebody had to teach me about. Like this may involve the name change or pronoun change, hairstyle, clothing changes, gender affirming hormone therapies, gender affirming surgeries, changes in the voice. All these physical manifestations help a person be who they want to be. So, it's all affirming the gender that they are. And it's not somebody like myself or other healthcare providers who can affirm these people. They have to have affirmation within themselves, so we have to follow their lead. And really, that publication up there, affirmation services for transgender and gender diverse people. It's a wonderful little publication. Please try to get it. I believe it might be included in the handouts, but it's from the program at Fenway Institute with the National LGBT Health and Educational Center. So there are a lot of resources out there. Please feel free. I insist that you look these things up and do your, like I say, do your homework. It's going to be better for you. It's going to be better for your agency, and it's going to be much better for your transgender clients. And that's all I got. Thank you.
Thank you so much, Gary Paul. This information is so valuable. I'm going to mute you while I introduce our next and last presenter, Mr. Shawn Coleman. Shawn Coleman is the founder and executive director of the nonprofit organization Destination Tomorrow. His grassroots organization serves all ages of LGBTQ people in the South Bronx in New York, with a focus on 13 to 24-year-olds and the transgender community. He started the organization in 2009 with no external funding. Mr. Coleman used his personal 401k funds and the support of his friends and family to make his dreams a reality. In the early stages of Destination Tomorrow, its program served 5 to 10 people a week, and now they're serving more than 300 people weekly. Mr. Coleman was clear on his mission, and his story speaks to the power of becoming a leader in the transgender community and executing his goals. In his own words, and I quote, "Many of us in the queer community know our life's purpose, but are too afraid to follow through on it." The span of Coleman's life, going from being an LGBTQ youth from the Brooklyn, New York, to providing the very services he once needed, is an inspiration to the people he serves today. So welcome very much. Thank you, Shawn, and I'm going to unmute you right now. And the microphone is all yours.
Hello, can you hear me?
Shawn? Yes, we can hear you.
Perfect. Hello. Thank you so very much for including me in this vital conversation. I'm truly appreciative to be here, sharing space with you and sharing some information. And thank you to my panelists. You guys have provided some excellent information, and I'm going to try to not repeat anything. On my first slide, I wanted to include something that to me spoke about engagement, right? When I look at this photo, I see 15,000 opportunities at engagement. This event happened last week in Brooklyn. It was the Black Trans Lives Matter rally, right? So it's important for so many reasons. It's important because that's the first time, it's historical in that it's the first time that we've been able to get that many people in one space to kind of come and support and uplift the voices of Black and brown trans folks advocating for trans rights. So I wanted to show you that for that reason, but I also wanted to show it as an opportunity to show you what true engagement would mean, right? So if this was me and I'm looking at this, I would have wanted information prior to this event so I can send my staff and myself out to cover this event, because those are the folks that I am looking to engage. So my question to you is, how are you engaging the networks, coalitions, and communities within your regions of those populations or communities that you're trying to engage? So if you're audience is the TG&C community. What kind of relationship do you currently have with members of the transgender and gender nonconforming community within your regions or communities? Next slide, please. Today, I'm going to do my best to help you better understand how to effectively engage members of the trans and gender nonconforming community. I hear a lot about engagement. I want to discuss effective engagement. We can come up with all kinds of strategies, or we can put together this cookie cutter model, but at the end of the day, it's going to be trial and error and figuring out what your particular region wants to see and filling in gaps in services and making sure you're doing it all with community buy-in. The community has to be at the table. Next slide, please. First, I'll give a little bit of information about Destination Tomorrow. As was stated, the organization was started in 2009. It was a volunteer-led organization. We began serving LGBT young people and the trans community. By 2017, we became the Bronx LGBT Center through discretionary funding from the New York City Council, and we've received these funds each year. It's historical in the fact that Destination Tomorrow, the Bronx LGBT Center, is the first LGBT center in New York State history to be managed by Black and brown trans people. So we're incredibly proud of that, and we provide a safe, affirming space for all members of the LGBT community. Some of the programs and services we offer are HIV testing and counseling, counseling and case management, peer support groups, and GED prep job readiness. I like to say my engagement strategy is also my hiring practice, right? I make sure I hire from within the community. So I have a robust staff made up of community members who have community buy-in. So we get an opportunity to go back into our communities and figure out, we keep our feet on the ground, if you will, to make sure we understand what trends are happening, what language, how the language is switching, what programs are effective and which ones aren't, so we understand who we also need to partner with as we try to continue to provide affirming TG&C care and services for our clients. Next slide, please. Why is engagement, what is engagement? So client engagement, it's just to me, it's relationship building, right? It's making sure that I understand who you are and what your needs are and how best I can help fulfill those needs. I made a statement earlier. It's about community buy-in. It's making sure that the community understands your mission, vision, and goals, and they see themselves in that mission, vision, and goals. And therefore, they're willing to come and partner with you, if you will. It's a partnership whenever a client or community member steps in your front door. You're providing a service for them. And in return, they are now a customer, if you will, and they will go back into the community and let the community understand what kind of services and programs you provide, and if they're effective, and if they're affirming, and if they're safe. So your relationship with the community is going to be essential. The engagement needs to match the community, right? You don't want to put together a program for this umbrella program for the trans community when you're really looking to engage trans women of color who may have been former sex workers. Like, if you have something that specific, then your marketing and your engagement needs to be as specific as the audience that you're looking to engage. COVID-19 has presented a unique challenge for engagement, some good and some bad, because it's giving us an opportunity to engage folks on a digital platform. And on this platform, that it almost feels like folks lose their inhibitions, right? So whereas they may not have walked through the front door of Destination Tomorrow out of being fearful, now I can attach a link to a Zoom call or a Facebook group, and within the click of a link of the mouse, they're already in the room with me. So it's provided a lot of opportunities for us to switch how we engage LGBT people. Next slide, please. Why is engagement for TG&C community members important? It shows that the provider is competent in working with TG&C community members. And I want to kind of take a step back from using that word competent. And I'm going to switch competent for, I'm not confident, but it shows that the provider is willing to work with TG&C community members, meaning you see it as a partnership and you're willing to invite us in to find out what it is that we need. It helps to build relationships with the TG&C community. So again, if someone comes into your space and they have the best experience in the world, you're waiting room is affirming. You have a literature that looks like that community member. They feel included. It's a safe environment, meaning no one in this space has misgendered them. They will go back and be the best engagement tool you have, because they will make sure that you are at any and every table that is relevant to trans and gender nonconforming folks. And it has to be diverse, right? We have to make sure that we're looking at our trans and gender nonconforming elders and those who are differently able. We have to make sure that whatever engagement strategies we put together, we're being conscious of these things. If the client is visually impaired or hearing impaired, does your engagement strategy speak to these differences, right? And how best would you do that? Who's representing you for that, to that community? And again, your community has to see itself within the organization. We wear so many hats at Destination Tomorrow. Not only are we most majority trans and gender nonconforming, but we're also a part of the house and ballroom community. Some of us are seniors or elders in these communities. So it gives us an opportunity to have community buy-in, because we are representative of those communities that we're seeking to engage. Next slide, please. Best practices. For me, some of the best practices have been focus groups, right? They're an excellent way to obtain community buy-in and to understand the needs of the community, right? One of my pet peeves is when providers put together these wonderful programs that haven't been battle tested by community members. They haven't asked the community members, is it even essential or something that they're looking for? And then they wonder why it fails. So focus groups are an excellent way to begin an engagement strategy with the TGNC community. Community advisory groups are another way. With the community advisory group, it's almost as if that person wears a dual role. They are an ambassador of the agency, if you will, but they're also a community member. So they give you an opportunity to have a bird's eye view of what that community is thinking and feeling. And lastly, inclusion. And Gary spoke about his social media campaigns. You have to make sure that target audience is highlighted in these campaigns. And then one other thing that I want to say, someone asked the question earlier about engagement, and how best to do these things. I think the best thing to do is hire trans people, right? Don't automatically assume that this information, that they're going to be so willing to give you this information. If you are requesting labor, then you must turn around and pay for that labor. And no better way to do it than to hire trans people. We are the experts of our own lives. We understand what's best for us with regards to policies and procedures. We know how to lead. So if you want to make sure you're effectively engaging folks, hire trans people. And your staff, your board needs to represent some of those folks. Because if your board doesn't understand why you have to shift some of the policies within your agencies, say now go into an all-gender bathroom because you're cis and white or cis male, and they don't get it, you have to make sure you diversify these boards and make sure trans and gender nonconforming people are sitting at some of these tables. So when these policies and agenda items need to be switched, there's an understanding as to why. Thank you for having me, and I'm more than happy to take any questions.
Thank you. Thank you so much, Shawn. And I love the closing, because yes, we need to hire trans people, but not only for outreach, but at all levels, providers, managers, case managers, administrators, at every level, CEOs. I mean, they can do everything, and they need to be there to really represent the community. So thank you. I'm going to open also Gary Paul's microphone. And here, please go ahead and ask your questions in the chat box. In the meantime, we're going to go ahead and answer this. What are logistical or environmental changes that can be made in the clinic that supports trans patients? I know, Gary Paul, you mentioned some. Could you give us other examples of this, please?
Yeah, I mean, the main thing is some sort of visuals. Like I say, a trans flag, posters with trans, representation. These are, I think, are the main things that clinics need to do. But I think, to Shawn's point, having transgender people on your staff is highly, highly effective. People will go if you have a staff that looks like them, talks like them, and knows some of the ins and outs of that community. So I think that's the main thing. But environmental changes can include, just little things, but they've got to be trans friendly. And like Shawn also said, your community will tell you what they need.
And one of the things we look to do, we partner with Montefiore, and I think there's a huge issue around how care is given, right? And they're almost given like this gendered care. And to JT's point earlier, him being in the clinic and them calling him by his dead name, and then making an excuse for it. Like, is your clinic safe? And is it friendly for the type of client that you're trying to bring in? So one of the things that Montefiore was willing to do is they did separate days for GYN care for trans guys, right? Because who wants to be the bearded guy that's sitting in a reception area with a bunch of women as we're all waiting for some specialized care? So looking at your clinic and seeing what some of those challenges could potentially be, and then trying to brainstorm around ways that you can address it.
Yeah, thank you. And that kind of answers the next question that we had, Shawn, that what is important to providing alternative hours for your transgender community? What other strategies need to be considered, like outside services? You gave an excellent example right now. Anything else?
I think to the point about why it's important to provide alternate hours, because a lot of us don't lead 9 to 5 lives, right? Destination Tomorrow works from 11 to 7, because we do understand that those later hours will attract the population that we're looking to engage. Some folks don't want to come out. Some of the trans brothers and sisters don't want to come out until as the sun goes down or it's dark outside or whatever. For whatever reason they feel safer. You have to figure out from your community what hours of operation work best for them, and as long as they're within reason, then it should be considered.
I totally agree. I'm sorry. I was just going to say that, a lot of the girls we have out here, a lot of them are sex workers. So I'm not going to have my staff out there trying to hand out condoms at, 2 o'clock in the morning, only for their own safety. However, you've got to realize that these girls are not going to come from 9 to 5. So you got to find some way to, like on a Saturday or something like that, have some of these services available. Condom distribution, I'll just tell the girls, if you can just swing by on your way to work, I'll drop them out the window for you if you need me to do it. So, the community will tell you, what they need and when they need it.
Thank you. And we have a few questions. Actually, Gary Paul, somebody while you were presenting asked, do you recommend that we create trans-friendly medical provider list, or does that already exist?
Do what? I'm sorry?
Do you recommend that each organization makes their own trans-friendly medical provider list, or is there something that already exists that they can go find?
But yeah, I think there's if you can make your own list, fine, but you might want to check with some of the bigger organizations, like, for example, Destination Tomorrow, or in New Jersey, you've got the Hyacinth Foundation, or NJCRI. They're going to have a lot of expertise because they have more clinical experience than I would have. So they're going to have a more inclusive list than I'm going to have. But I depend on these people, to help me. These are the people that I call when I have somebody that needs services. So there are some existing, all the legal hotlines and things like that. They're out there, and you just Google them, and you're going to find some. But talk to some of the existing agencies, and they're going to tell you who's good and who's bad.
But also, I'm sorry. Go ahead.
Go ahead.
No, I was going to say, but also, if you have a trans staff member, send your staff member to that organization and see the level of care that they receive. See how they feel when they walk into that space, because oftentimes folks are put on a list, and sometimes those services don't even exist anymore, right? Some of these lists are really, really old. So it's best to develop your own list, and it's also best to make sure that the level of care is what your clients deserve. And make sure it's from the front door to the waiting room and out. If they're having a tough time with security or trying to get into your space, that could potentially be a problem. So I would suggest developing your own list, but making sure that you're testing that list to see if it's actually as safe as you want it to be.
Amen. Amen.
Perfect. I have one last question before we move on to open it for all the panelists, for either of you. How would you update outdated language used on client paperwork, and how would you implement that in spite of coworkers that don't see the need to do so?
Oh, wow.
And this is the reason that there needs to be trans and gender nonconforming representation on these boards, whether it's a hospital board or a community board, that representation needs to happen, because oftentimes though the members that are in the room that are deciding to stick with these antiquated systems just don't understand how toxic it is and how dangerous it could be, right? So we have to make sure first that you're going to the top with this request. You can start within your department, but if they don't change their policies within the top office and it trickles down, it's going to be a really, really difficult battle, because there's always going to be that one person who's set in their ways and will say, well, this is how I was taught to do it, so this is how I'm going to do it. It has to come from the top. The top has to make sure that they understand why it's so important. Also, data collection is incredibly important. So your argument to the higher ups within your organization or agency can be, we want to make sure we're capturing the most accurate data as we report it back to our contractors, and this is the best way to do it. And then give them some examples on how.
You have to realize that stigma and prejudices still exist, and they still exist within the LGBT community at large. So you have to be aware of that, and you've got to learn how to protect your clients if you want them to have, positive outcomes.
Exactly.
Great. I'm going to go ahead and open the mics for JT and for Adriana. So please go ahead and ask your questions for any of our panelists. In the meantime, I already have a few here. So JT and Shawn, can either of you speak of any issues for transgender men that need to be considered in prevention, care, and treatment that are very specific for you?
Well, what I've learned is that there's not that much data on us. And I would recommend, even if, say, so I work in the HIV field, even if the Department of Health in your state hasn't started collecting data, maybe your agency should go ahead and take that initiative and be proactive in collecting data about transgender individuals. For trans guys, it seems like people are more interested in the experiences of transgender women and the risks. However, I think there's a misunderstanding too that transgender guys can put themselves at the same types of risks. And I'm talking about sexual behavior here. So I hope that answers the question. I had a knee-jerk moment to that.
Okay, so I'm going to be asking Shawn, do you want to add anything to that?
Oh, no, go ahead.
Okay, great. Can any of you give us an example of an outreach strategy that works specifically for the transgender community that might not work for the rest of the LGBTQ community, for example?
It's just like I said in my presentation, that one size does not fit all. So if you gotta do your research and do your homework, man.
Anybody else?
This is Adriana. My organization was an expert in outreach for the transgender community. One of the things is we have a 24/7 phone where I have in my right hand and answer any of the questions of the transgender, specific and the weekend, specific for PrEP. When the transgender they breaking the condom and the weekend, they calling and they want to have a services. Also, we going to go another specific program, because a lot of the organizations they say, we don't know where we have a transgender. If you hire one transgender person and if you develop a program, you can know what it is. Other programs, other websites, right there, and the Fan for Four is different. Other website where a transgender they are daily, every day, chatting and those and navigate and those and those programs. So one of the specific thing is innovative programs online where you can help for transgenders.
Thank you. We had a, go ahead.
I think strategy has to be based on environment, right? And it needs to be based on the region. So I think again, that's a question with what it is you're seeing within your community, and what other folks that are looking to engage the TGNC community are doing. I don't think we should look for this cookie cutter approach, but like really develop strategies that are in line with our mission, but also with the purpose of why we're trying to engage this community. And to the point about trans men, I think visibility would be the first thing. Accurate data collection would be the second thing, and the realization that HIV prevention, such as testing and condoms and PrEP, need to be readily available for this community, and providers need to understand that we are sexual beings as well, and we need to be engaged in some of the same ways that other communities have been engaged with regards to HIV prevention.
Thank you. Thank you. I have a question that we received from one of the participants. Some of you have mentioned it, the importance of this, but what do you do when a transgender patient desires to be addressed by their preferred name rather than the legal name? What policy should an organization have to make sure the patient is accommodated, but also that we're following the law?
Well, you know what, I think, go ahead.
Work in one HIV clinic. Yes, I used to be working one HIV clinic, and that is one of the defense of the people. They don't want to change the name of the transgender in the medical. I know some medical record, they are legal and they have to go by the name, but you can use different ways to make that client comfortable in your clinic. You can call Mrs. Rodriguez or Mrs. Lin or Miss Lin prior to the Jose Antonio, right? So it is the way, that is all the questions when we are transgender people, they want to go and talking about change different things, the legal. Oh no, we don't do this one because it's not legal. We don't have to go by the legal things and the male or female. And is the way in your clinic, when expert and academic people you have and the sensibility you have to change legally those things to make a transgender client more comfortable in your clinic. Make sure when you lose one transgender in your clinic, you're going to lose 20 transgender in your clinic. And some clinics, that's why they don't have many transgender. And I'm talking about data. It's very important to founders. Founder data. We have a program in Puerto Rico to developing the first data for transgender individuals and trans men, only specific in all Puerto Rico. And I'm knocking doors for all the things. Right now, we are collecting the data right now with a specific role, specific very slow resources, but we are doing because you know how transgender talent are. So when we're talking about data, it's very important to support the data, helping developing data, because in my organization, what I want to do for the transgender community is 3 points. I learn to the clients 3 points, right? The key point. My data, my personal history, and my leadership. That is the whole 3-point key for transgender. Go and present to the field.
Thank you, Adriana. Anybody else would like to add? We have 5 more minutes.
I would say that any organization or any office that refuses to use the name that you've asked them to use, I would do like Shawn, bounce, man, go somewhere else. That's very, very basic. If you can't make your clients feel safe and welcome, and by continuing to use somebody's dead name, is not. I understand the legalities about it, but if you're still refusing to call your patients by the name that they want to be called by, you need to find somebody else. Period.
Thank you, Gary Paul. So I have one last question here. In terms of the law, wouldn't outing a person as transgender be a HIPAA violation, for example, in a waiting room?
Can you
I guess
say
we
that?
would like to know. Yeah, I guess we would like to know about in regards to law. Is there a law that states that the provider has to use your full legal name? Would it be a violation of a HIPAA law to, say to anybody, that the patient is a trans person? What is the law in regards to, protecting or regulating this type of customer service?
Well, I think if you are in a clinic and the help providing health services, you have to be careful when HIPAA training and educate transgender community about the HIPAA regulation. One of the bigger issues and bigger problems in my organization is hire transgender and explain about HIPAA regulations. So it's very important to give the information about HIPAA regulations for the whole employees of your clinic. I don't know if I answered the question correctly.
Yeah, I think so. Okay, so anybody else? We're gonna go ahead and close. This is not the end of our conversations about the transgender population. We're actually going to be having one of our speakers, JT Perez, tomorrow in our Coffee House Wednesday. Brenda has put the link in there. It's 1 hour. He's going to be there answering more of the questions from today. And, it's a good time to invite coworkers or go back and join us. Anybody would like to say final words?
Oh, just keep up the good work, y'all.
Gary, I'm sorry, Gary, all the time I stop with you, but I just want to say thank you to the National Center for Training, Support, and Technical Assistance, because really have this kind of training to sensibilize the other fields is very important. So thank you so much, and just anytime what you need, you can visit the website of my organization. And also, I think they're going to send you a video where I make about the importance of the health providers for helping the transgender community. Thank you so much.
I just want to say thank you for having me. And in closing, just show up for trans people, right? You can't want a one-sided engagement. So it's incredibly important to show up for trans people. The next time a Black trans woman is murdered, the next time a Black trans man is murdered, we have to be there to make sure they understand that we're working and fighting for them as well. Thank you.
Great word.
I completely agree, Shawn. And thank you for this experience. Thank you to those that joined us today. I really appreciate seeing so many people taking an interest in transgender care.
Yes, and hopefully this is the beginning of a lot of changes, of improving the quality care that this community deserves as any other person. Here is a list of some resources. Again, to join us tomorrow, we're going to be having JT Perez answering the questions. You are going to be getting an email with a link for this, as well as a copy of the PowerPoint, the recording, and the other materials that have been shared. If you have any additional questions or you're interested in receiving individualized CBA, please contact us. Here's my contact, and Brenda, as well as the organization. Follow us on social media. And please make sure you take a few minutes to complete the evaluation at the end of this. This gives us a great feedback, not only about how this session went, but it's a good opportunity for you to tell us what else you would like to see in the future. We probably we'll have more about the LGBTQ and the transgender community coming up because it's such an important topic. But please take a few minutes to do so. And we wanted to thank you all for being here. And like I said, we will see you tomorrow with JT, and have a wonderful day, everybody. Thank you.
Have a good day.